A blessed day, everyone. I'm Lauren Lorbes Balonzo, taking up Master of Arts in Nursing at Wesleyan University of the Philippines from Batch 10, Section A3. I'm also working as a staff nurse at Day Surgery Unit in Blackpool Victoria Hospital here in the United Kingdom. So, in partial fulfillment for the requirements on the subject Nursing 204, which is under Professor John Valeria, I've prepared this e-learning specially designed for newly hired nurses who are about to practice at any area of specialty. So I've chosen the topic on a common procedure which is being performed by healthcare professionals, especially nurses, which is venipuncture. But this still has to be augmented by a practicum so that nurses would be signed off before they eventually perform this skill as safely as possible for each and every patient that they will be encountering. So I find this instructional tool more convenient for nurses to study on at their own pace and at their own time. In this presentation, the following topics will be covered. So I've already started off with the introduction, to be followed by the entire contents that would be discussed, learning objectives, the entire course outline, what is venipuncture, its purposes, equipment that is required, procedural steps, potential risks, and a summary. In this presentation, I've come up with the following learning objectives wherein nurses would be able to learn about the principles and purposes behind venipuncture, learning the appropriate anatomical sites and familiarizing themselves with the right equipment, and how to perform this skill as safe as possible to their patients using aseptic non-touch technique, knowing the possible risks after venipuncture, and knowing the importance of having trained. This e-course outlines the following: what is venipuncture, its purposes, equipment, procedural steps, and risks. Now, what is venipuncture? So, it's an essential practice for various medical diagnoses, procedures, and tests, wherein a healthcare professional would draw blood for these purposes. It's especially vital that nurses learn the proper method for drawing blood as well as the various venipuncture techniques in a healthcare environment. What are the purposes? To acquire blood samples for diagnostic purposes, to monitor levels of various blood components, to administer therapeutic treatments intravenously, including medications, nutrition, or chemotherapy. For removing blood to combat high levels of iron or red blood cells, to collect blood for later uses such as blood transfusions. Suggested supplies are the following: evacuated collection tubes, personal protective equipment, needles and syringes, tourniquet, hand sanitizer, alcohol swabs, laboratory specimen labels, gloves, and blood transfer device. The specific equipment to be used in this procedure are the following: needles and syringes, tourniquet, hand sanitizer, alcohol swabs, laboratory specimen label, gauze, blood transfer device, tape or adhesive bandages, laboratory forms, biohazard leak-proof transportation bags, puncture-resistant sharps container, and request information. This photo shows a well-prepared tray with the appropriate equipment all arranged inside, namely a winged butterfly needle, gauge 23, a gauze, alcohol swab, a medical tape, a pair of non-sterile gloves, blood tubes, barrel, and a tourniquet. Shall we proceed with the specific venipuncture steps? Firstly, explain the procedure and reason for the blood draw to the patient, followed by identifying the patient using two patient identifiers as mandated by the Joint Commission, JCAHO. Thirdly, confirm the ordered blood tests and fill out the appropriate forms and labels. Fourth step, check for any allergies or sensitivities with the patient. This photo shows the specific veins that have to be used when rendering a venipuncture, but it is highly recommended for the medial cubital vein in the right cubital fossa to draw the blood. However, there are other alternatives such as the cephalic vein and the basilic vein. Shall we move on with the fifth step, wherein the nurse has to position the patient and hyperextend the patient's arm. Also, the nurse has to perform good hand hygiene and wear the appropriate personal protective equipment, such as wearing an apron and wearing sterile gloves. Seventh step, applying a tourniquet approximately 3 to 4 inches above the selected site. Eighth step, ask the patient to make a fist pump. Ninth step, cleansing the venipuncture site with an alcohol prep pad for 30 seconds and allowing it to dry for 30 seconds. Followed by the 10th step, grabbing the patient's lower arm firmly to draw the skin taut and anchoring the vein from rolling, inserting the needle at a 15 to 30 degree angle into the vessel. If properly inserted, blood should flush into the catheter. Next step, attach the needed tubes or syringes to remove the proper volume of blood. So this illustration shows the step-by-step procedure that has to be done for the patient. Shall we carry on with the 13th step? Removing the needle from the patient's arm and pressing down on the vessel with gauze, followed by the next step, disposing of contaminated materials and needles in the designated hospital-approved containers, followed by labeling the appropriate tubes at the bedside and placing it into transport bags, and finally delivering the blood specimen to the laboratory promptly. This figure illustrates the last few steps that I've mentioned earlier upon completion of the venipuncture procedure for a patient. There are other convenient ways to draw blood from a patient, wherein in this photo, a butterfly winged needle was used via a proper vacuum system for an appropriate amount of blood to be drawn. There are varieties of blood testing tubes wherein that would depend on the color with its corresponding purpose. Like the pink colored tube, it's usually being used for a group save and cross-matching purposes, whereas the red one usually for biochemistry tests, the gray one to test the glucose and lactate. There are possible risks or complications that could arise right after a venipuncture. Firstly, is cellulitis, wherein it's a common but potentially serious bacterial infection of the skin, wherein the affected areas typically appear swollen and red. Next is phlebitis, wherein it's the inflammation of the vein, wherein it can occur due to blood clots in the vein that can cause inflammation. Next is hypotension, which is low blood pressure, which can result in fainting or dizziness. Next is syncope or near syncope, wherein it's plainly fainting or a sudden temporary loss of consciousness. Next is seizure activity, wherein a sudden and uncontrolled electrical disturbance in the brain, wherein it can alter your behavior, movements, or feelings. So in summary of today's presentation, I'll be mentioning two main points wherein it's very essential for nurses to learn the skill of venipuncture for the provision of a practice-based evidence care of patients. Next, learning its principles, purposes, right equipment required, systematic steps, and possible risks would increase one's competency in performing this procedure. The following resources were used behind this presentation, which is the unitechcollege.edu, British Journal of Nursing.com, simpleosky.com, and ncbi.nlm.nih.gov. Thank you so much for your time and interest for learning the procedure on venipuncture through this e-course, and wishing you all the best in your future endeavors as a practicing nurse. God bless everyone.